Yes, good morning. Thank you for allowing a few minutes for our team to speak. September is Suicide Prevention Awareness Month, and our team has been extremely busy the last 30 days, both clinically and in activities to foster support and increase awareness for suicide prevention. As an example of how our current pandemic has impacted the mental health service, our suicide prevention team is currently managing nearly twice the number of veterans identified to be high risk as it would be any given week prior to the pandemic. This is consistent with the notion that COVID-19 would generate a perfect storm for suicide risk. I would add that suicide prevention is everyone's business. It's a high priority in our VA. There are also a very small number of mental health staff who shoulder a disproportionate weight for suicide prevention. I asked them to join the morning report this morning. Dr. Hunter and Emily Siegel are from our clinical team, and Jennifer Corradolo and Michelle Chavarria from our community engagement and partnership coordinator program. And Dr. Hunter, could you give us a brief overview of some of the activities this past month? Thank you.
Absolutely. Yeah, we've been very busy this month. We've had a number of overlapping Suicide Prevention 1.0 and 2.0 activities, and we certainly owe a debt of gratitude to Jennifer and Michelle, who took the lead in organizing many different outreach events and ensured we had planned a meaningful activity every single day of the month, actually. Some outreach highlights include attendance at the AFSP, that's American Foundation for Suicide Prevention walks, which included Saratoga and Delaware counties. We had a stand down in Delaware County. We had a Chalk the Walk event here, which was very successful. We had a remembrance ceremony that had strong media coverage, and in-house we've been doing the swag and wag, where we give out some of our swag out in the lobby and also out on the by the Visit 2 building. We also held the wellness challenge and many other events. We've also given out about 500 gun locks at these events, and along with many other tchotchkes that share the VCL number.
Thank you. Emily, do you have a small clinical anecdote you might share?
Yeah, absolutely. Most recently, one that comes to mind is a active duty combat veteran who is in the National Guard who came through the Veterans Crisis Line, and she was having trouble getting connected, and she is in the process of med boarding out, and she was struggling and getting connected with services. So she reached out to the Veterans Crisis Line and accepted a consult from our team. And so when I reached out to her, we were able to get her connected to the PTSD clinic and the MST coordinator due to MST that she underwent while she was deployed most recently, and also medication management. And until then, part of what our team has been doing is helping if a vet is deemed high risk, is helping to do check-ins with them and provide them that additional support they may need so they're not waiting for an intake appointment. So I've been meeting with her to help her while she is waiting to start and get enrolled with PTSD and medication management.
Thanks, Emily. Michelle, do you have some information you might share about community engagement?
Yes, so during this month and the community engagement that we have done, it has not only allowed us to reach staff in-house, but it's also allowed us to communicate with our community partners and our stakeholders. As Jen and I continue to work on building these relationships and solidifying these coalitions, I want to just highlight some of the work that we've done as we've entered this position. One of these relationships that we're working on strengthening is the one with our North Country catchment area. I want to give a quick special shout out to the Plattsburgh Clinic and their staff for the support that they've given us as we continue to strengthen our presence up in the North Country. Also, I just want to pitch, we do have an educational presentation today from one of the partnerships that we have been working on solidifying with the New York State Council of Problem Gambling. So that event will happen today virtually at 12 o'clock via Teams. I want to give a special shout out as well to Maureen Corbett because she assisted with that introduction to the New York Council. And also a special shout out to Dr. Waite, who has, Maureen and Dr. Waite has supported us with solidifying and establishing our coalition with the New York State Council for Problem Gambling. So bringing to the community efforts on veterans and problem gambling. So that's a little bit of what we've been doing.
Thank you, Michelle. And Jennifer, I think you might have some closing comments.
I do. Thank you. You know, on Sunday, we were at the Walk for Rita in Saratoga, the American Foundation for Suicide Prevention Walk. And I don't know how many people know this, but every year, Ed Maloney, you know, takes his own time and he registers Team VA. He creates the flyer every year for it. And he really just has always taken the lead as long as I've been at the Albany VA for the last 8 years. And he does it on his own time for his own purpose, you know, for professional and personal reasons. And it really got me thinking that a lot of people support us in the facility, and, you know, they do it on their own time. They do it without being asked. And so I don't want to sound like we're at the Academy Awards and thanking a lot of people, but I did want to just acknowledge it. You know, starting with our leadership, you know, especially our hospital leadership and supporting Michelle and I with the 2.0 position, you know, that was really huge, allowing us to have 2 people in this role and further strengthen our suicide prevention in the facility. You know, our mental health and social work leadership, Dr. Payne and Dr. Breen and Jen Audette, really just supporting suicide prevention as a whole, and even like allowing our colleagues to help us in outreach events and even clinical support, like Dr. Sanan, who has, you know, been allowed to help us with clinical support with our high-risk vets when we're understaffed. And, you know, our patient experience, Glenn Gilbert, he really has been crucial in allowing us to tap into peer support and the homeless team on different outreach events, especially in Americaid. James Arrington, you know, I know deep down, I think he might hate Americaid, but I can't confirm or deny that. But he did allow his staff to come and attend with us. It didn't take much convincing. He was very happy to, you know, allow David to come with us. And that was really great because a lot of people came up and specifically asked about enrollment. And those questions were really important and really helpful to have someone who had all that knowledge. Marlene and Harrington and Sean Tuckey, who really were a huge force in the Chalk the Walk. I'd love to take credit for that, but I can't because they were really great with coming up with the idea and implementing that. And, you know, Sean and Peter Potter refused to give me the password to our social media platforms, which I understand, but they've never, you know, hesitated to share our material. They always send out the postmasters, and, you know, that's been really great in getting the word out there, not just in the facility, but also in the community. And, you know, of course, Bruce Swingle, who always helps us with the remembrance ceremony, and, you know, Mike Fitzpatrick, who allows us space at the Fisher House, but also has been able to connect us with people at the Red Cross, where we might be able to, you know, facilitate a Survivors Day of Suicide with AFSP. And so, you know, all these connections have been really helpful. And, you know, the Women's Clinic and in partnering with us on outreach events. And it's a lot of people. I could go on for a really long time, but I just wanted to specifically name a few people because they've been so helpful, you know, not just in September, but all year round. And so we just want to say thank you, because it's like Dr. Breen said, you know, suicide prevention is everyone's business, and we appreciate you, you know, being in our business and allowing us to like really reach as many people as possible.